Hello everybody, it's Victor here from Cardiac Wire, and today I'm joined by Dr. Fawaz Alenzi from Duke University to talk a little bit about the results of his late-breaking study here at ASC 2025. Dr. Alenzi, with that, congratulations, and why don't you introduce yourself a little bit?
Thank you for having me. I'm Fawaz Alenzi. I'm a cardiologist working at Duke University, interested in multimodality cardiovascular imaging, and that includes all cardiac CT, cardiac MRI, and echocardiography. Also, my research is focused on innovation in cardiovascular imaging, which I'm very sure we're going to talk today about.
So with that, could you tell us a little bit about your study here at ASC that you presented?
Yeah, so this is, well, again, thanks. This is one of the most promising studies. Our motivation stemmed from the fact that hypertrophic cardiomyopathy is really one of the most common inherited cardiovascular diseases and the most common cause of sudden cardiac death in young population. However, it's still underdiagnosed. Research really showed that about 80% of hypertrophic cardiomyopathy still underdiagnosed. And that's because of multiple reasons. One of them, the presentation usually vague, and then the manifestation is really subtle.
Interesting. Could you go a little bit deeper on some of the key challenges in diagnosing HCM?
Oh, so if I think about this question, I need to think about three things. One, subtlety. Usually the manifestations of this disease not unique. Usually the LV wall thickness, and sometimes they present really with borderline manifestations. And then even the regional wall thickness, usually in places where sometimes a traditional echocardiography or echocardiographer cannot catch. That's number one. Number two, variability. There is really a significant inter-observer variability. The way how we really measure the wall thickness, it's not unfortunately, not simultaneously, not reproducible every time we do it. And then the last thing, and it's the most important things, I guess, is the access to expert cardiologists. Think about it. Not in every cardiac center you have an expert people who really can know how to diagnose hypertrophic cardiomyopathy, or even they have kind of additional imaging tools like cardiac MRI, which can help people to diagnose hypertrophic cardiomyopathy.
Well, I really appreciate that in-depth answer, and I know a big part of a lot of the work you do is with AI. As part of your study, I know you worked with the US2 AI HCM model. Could you tell us a little bit about that AI model and how it was developed and validated?
That's a good question. We were fortunate to work with US2I. US2I really developed an algorithm that has high accuracy in diagnosing hypertrophic cardiomyopathy. And then if you think about imaging and AI in general, what you really need two things: big, clean database and a high accuracy algorithm that can diagnose these diseases. So the way how we really diagnose these diseases really use an US2I that we run about 1,500 hypertrophic cardiomyopathy. Not only this, we also rerun the model internally and externally for validation. And then still the result is very high, and we were excited about it.
So with the precision and efficacy of this model, what are some of the clinical applications you see this going forward and supporting HCM screening in the future?
Yeah, thank you. So the way how I think about this as a triage or as an augmentation tool that you can use. Imagine if a general patient who done an echo in a general echo lab, and then you run it through the tools, and then the tools diagnose hypertrophic cardiomyopathy, and then also the system will signal this patient to transfer this patient to the right doctors, and then you can diagnose those patients, you can give them the right treatment, you prevent one of the most common cause of sudden cardiac death. That's number one. Number two, really when we run the model, it was very capable with the normal, with the high expert cardiologists who have expertise with hypertrophic cardiomyopathy.
Interesting. And so looking ahead a little bit with the clinical applications, what do you see as the future of applying AI to something like diagnosing HCM?
So there are multiple things. In the future, we hope to, first of all, to add it with multimodality imaging. Example, I will add to AI also ECG recording. I add maybe genetics. I add also cardiac MRI, and have a multimodality comprehensive AI tool that can really diagnose patients, not only this, and can also predict their outcome. That's number one. Number two, we can use it as a tool to look for disease progression and response to therapy. Like some patients really you cannot tell which patient you can give the right medication, but if you follow those patients for a long time using this tool, you can diagnose the patient early and you can give the right treatment.
So with all that background on the AI and kind of how it works, I want to zoom in a little bit on your study. What did you find when you applied this model to your study, and what were some of the results that really stood out to you?
So what's really interesting and exciting, that we got the highest accuracy results using an S2I algorithm in 1,500 hypertrophic cardiomyopathy patient that was confirmed and done with expert cardiologists, and that was proved also by using cardiac MRI and genetics. That's number one. Number two, also, if you think about it, really what we really got the validation. We also catched and with different cardiovascular centers to make sure like our result really similar or with the same high accuracy with other centers, which we called validation, and that happens, and the results still consistency and reproducible amongst all internal and external validation.
So with the strength of those results, what's one takeaway you have for our viewers here today?
Yeah, so again, thanks for having me. I'm really excited because I think the next 5 to 10 years, in every lab, we're gonna have an AI tools, high accuracy and FDA approved like S2I, which is gonna help us really screen for patients who have rare diseases. You can really generate an expertise and you can deliver the expertise even in rural areas where people really don't have a cardiologist who have high expertise. Every patient will have an access using an AI to high expertise so they cannot miss diagnosis, and you can give the right treatment and diagnose them early.
Well, Dr. Alenzi, thank you so much for your time today. Thank you for all of this background on your study. It's very exciting results, and we're excited to see how it'll impact the future of cardiology.
Thank you for having me.